Good afternoon. This is Nimisha from PHT Health Services, and I'm glad we could connect once again. Every episode, we are covering key elements for our viewers. This is not only giving an holistic view of home healthcare and illness, but yes, definitely bridging the gap with our core knowledge of illness and foolproof strategy with diagnosis, medication, and care at home. With monsoon season around, we do face flu as one of the viral infection, which is a contagious disease. As per WHO, flu kills around 7 lakhs people per year. In this episode, we will be speaking to Dr. Tridib Chatterjee, who carries 2 decades of experience as a chest physician and a leader in healthcare domain. His experience will throw some light on this topic, the current situation in the country, and the elements that can improve the spread. Hello, Dr. Chatterjee. It's honor to have an opportunity to have a word with you. We have been serving the masses as home healthcare services organization, and we regularly receive questions from our patients and general audience via response to our previous podcast and other means. And today we are certain that having you with us will bridge the gap with the response to the key questions received. So here we start. We just survived an era of COVID, which is a prone to affect respiratory organs, while most of the masses has been affected and recovered. So, would like to question you, sir, on this and have some of your thoughts on it.
Hello, everybody. Thanks for inviting me for this very interesting discussion. So, as you know, the in COVID we had two major waves. The second wave, which happened somewhere around April of 2020, and then 21, and then ended towards the end of that year, which was the most major wave. Now the wave which is there, the Delta variant wave is there, but it is much milder. And by this time, our country has done a magnificent job of vaccinating majority of people. Most of 82% have received their first vaccination, and the second one have written the second. A large number received the second. So now, although the COVID is there, it's generally not very severe. It's very mild, but that doesn't mean that we should not continue keeping the social distancing, masking in public spaces, and taking care if somebody gets an infection, gets isolated, and checking whenever there is a doubt. So that should be done. But otherwise, by and large, most of the people of COVID who have survived have recovered completely well. And regarding whether they will get more chance of getting swine flu or H1N1 as it is popularly called as, not necessarily. If somebody has recovered from COVID, I mean he has recovered. So his immunity, unless his immunity gets in some manner altered, he has developed post-COVID diabetes, which is uncontrolled. Such select group of people they might be more prone, but majority people who have got COVID and recovered today do not do not necessarily have a more chances of getting swine flu. They are getting as much as anybody else.
Thank you, sir. This was great insight. Moving to our next question. In the current situation, post COVID, people are most inclined to get infected by H1N1 virus during flu season.
So again, as I said, the post COVID, if the patient, it is if that person has is having some amount of disturbance in his immunity, or he is in a crowded space which is there is no proper somebody has got the swine flu and is not really able to sort of segregate himself, then they may get. But it is not necessarily purely because of post COVID they will get, unless there is an additional factor of which is affecting their immunity with respect to age, with respect to chronic disease, or because he's in a public space, and or maybe like health professionals like us who are constantly treating people and constantly getting exposed to people. They are the ones in this post-COVID may get, but by and large, it's not doesn't happen.
Sir, as per our people who are having the daily travel and in our routine work, there are people who may have decline in the immunity effects. So, does this effect have the resistance to flu?
Yes, this is what as I was earlier. If your immunity is down, then you are definitely more exposed to just common flu and the more deadlier forms of influenza A, that is H1N1, H3 and 2. These two will be much more when the patients register. And if that person, as you said, is traveling, he's in public, in a public train, local train. I think nowadays everybody is now offline is started. It's not online now. It actually travel, and it's not. That is why government is still saying that you must mask yourself in public spaces and try to keep a distance, at least in public space places, and like in trains and movie halls or in aircrafts and all that. So if your immunity is low, 100% you will be more, your chances of getting flu is going to increase. Normal flu or swine flu also.
Correct. As you rightly mentioned, sir, there are different types of flu, and there is real confusion between the community. Either it is a dengue, malaria. So, what do you feel that what should patient watch for to see if they have allergies, cold, or flu?
See, now, as of now, it's all of them have got very non-specific. All these few diseases, malaria, dengue. But generally, malaria, dengue, you will get a lot of chills, you get high fever. But then, of course, you can get the same thing. So it is very difficult to just be sure. But if the patient has severe body ache and some more people are, and he has been moving around, then you can suspect. But yes, anybody who there is such symptoms, you always have to do a blood test to rule out malaria and dengue. Even especially now, this is the rainy season. This is a time where this malaria and dengue are increased. So you have to keep a check on that. But if they are ruled out and the platelet counts, the WBC count, the malaria, and the IgM, dengue, all the tests are negative, then definitely instead of loading the patients on antibiotics, which is what most of the people do, it is worthwhile thinking in terms of a viral infection. And so that is viral flu. Again, as I said, it could be just simple viral flu or it could be H1N1. But you must keep it in mind for any acute febrile illness at present.
Um, Sir, I mean, currently you have been experiencing so many patients in your clinic, I'm quite sure. So, what do you feel a common man fear is with regards to infections?
So this has really happened so much after COVID. I mean, people used to say, "Oh, ज़्यादा बुखार है, take Crocin." But now after COVID, this fear of God is, and I feel sometimes it may be a good thing which has happened. So now they are getting themselves tested for, as I said, the blood test, for a dengue test, for a flu test, for COVID test. So they are afraid because we've had people dying of infections of fever. So this fear now which has occurred is mainly because of the epidemic or the pandemic which has occurred with large number of people who have died. So that fear has come in mainly because of the COVID. And it's okay. Sometimes this fear is good to make you alert to seek medical help and not just do over the counter medications.
The patients may have these questions, and these questions have been coming repeatedly to us. That this vaccine does it require repeat to be repeated every year?
Yes, this is 100% yearly vaccine. This vaccine, just like the COVID vaccine, as I said earlier, we have another epidemic of a small surge of COVID infection, but no admissions. Why? Because as I said earlier, most of the people have been vaccinated. The same thing holds true here. If you vaccinate yourself for the what we call as the flu shot, which is the quadrivalent variety of the influenza vaccine, every year it has to be good every year. Please note the vaccine is never the same. The strains are made differently depending on what virus is present. Virus always mutates. So, based on whatever virus is there, this vaccine is prepared accordingly. And it is compulsory to take it. The maximum action it lasts is for 1 year. So, you must definitely take it yearly. There is no question about this.
Sure, sir. So, as per we all know, as per our population study, now it's going to be a geriatric shift in next 5 years. So, what would be your advice for our senior citizens who refrain from taking the dose?
So that is something which they have to be counseled, because they may be afraid of. In fact, this is the specific population who have to be targeted first, whether they have diabetes. As if you know, in America, everybody above the age of 50 is given influenza vaccine. We are talking about senior citizens, so it is absolutely mandatory that they have to be counseled. There are absolutely no side effect. It's a human vaccine. It is got it's a comes in a pre-filled syringe. I mean, it is given anybody. Actually, a layman can give it to a layman, because it just requires the cover to be removed and pushed in. It's not an injection; it's a vaccine. It and all senior citizens, even if they're 100 years old, must be counseled. And if they're just fragile and bone, there is enough muscle in them to give this vaccine, and they should be counseled. There are no side effects. Some people may get mild fever, but I have never seen that happen. And here the family, the media, all will be required to, and the doctor, of course, doctor has to be the main person uh, propagating it, but they have to be convinced that yes, you must take the vaccine and not to worry about anything, and yearly, that also yearly.
Sir, post your this message. Do you really feel can vaccination bring sustainability in the spread and effectively?
Yes, 110%. It has happened in COVID, as I said. It will happen. It definitely happens in H1N1. Here is in, I mean, 100% proof with people who you just mentioned about the large number of people who died of flu. Large number of them won't be vaccinated. So very many, all those who are vaccinated, the chances of dying decreases by 80%. So 110%, the spread of infection is stopped, and it is not only useful for the patient, but it is useful for the community. So vaccination for flu is good for you and good for the society. It must be encouraged actively.
Sure, sir. I think this answer will definitely help the community to give this message that how important it is to get the swine flu vaccination done. So, do you feel does media affect the decision of the patient with regards to pursuing shot?
Yes, media is, I mean, instead of just reporting deaths of H1N1 and, oh, dengue has gone on malaria, that's all right, that is a fact. But they should be used, they should interview senior doctors, senior health professionals, and sort of summarize what we are discussing, how useful it is. Common man reading the Times of India or any other paper in any regional language should read written there ki if you are above the age of 50, if you have got a chronic disease, if you have got diabetes, if you are falling illness, at least they should consult the doctor ki should I take the vaccine? And most of the time the doctor will give the right advice. So media, whether it is written media or TV media, it's not, they can, you know, I mean, for example, I can tell you the government of India comes out with ads propagating egg and milk. So why not vaccine? I mean, it need not be the name, a particular company's name, but influenza vaccine, flu shot must be encouraged in the media, because that's how the maximum it will reach to the maximum population of the country who follow the media, either on TV or on written media.
Surely, sir. I feel currently with so much awareness in the digital medium, and where our generation is constantly on the digital plus, and they are aware looking at the what is happening in the country. Just wanted to have your thoughts that how, as a home health care, can build a trust and bridge the gap here.
That is where, because many times doctors themselves are not aware. So now through your home care system, when the patients are and you are these home care people are treating the people who are chronically at home, who are sick, who are most of the times having some chronic disease, who are maybe senior citizens. So they are the ones who can actually give the vaccine, who can be uh, in consultation with the main doctor, the health professional. They must sort of give the vaccine and spread it. You just like the media, as I said earlier, the media, you people, the healthcare people, home healthcare people who are treating people at home, and once you treat somebody at home, you give one body, somebody else comes to know about it, the patient's son, father, brother, etc., and that's how it spreads. So it must be, you can only add to the popularity, or not popularity, the importance rather. The word is importance and seriousness of taking the vaccine regularly, and there are no side effects, and it is really good for the community and the person individually. So this is my plea to all people who are hearing. You consult your doctor, consult the home care services which with whom you are uh, working with, for yourself, for the person who is looking after, and get yourself vaccinated for the flu. In fact, there is a pneumonia vaccine also, but the flu vaccine 100% yearly for anybody, senior citizen, or in fact anybody. You can just take it. There are no side effects. Please take it, and you will definitely help in stopping this spread of swine flu, and definitely the yourself from getting a serious infection. I hope that I hope you will listen to what I have to say.
I'm quite sure, sir, your message to the community will go very strongly. And being from this forte, definitely the interest level of the patient and the awareness we as a PHT Health Services could message to the community from your end to us. Thank you so much, sir, for
Thank
being
you.
with us and giving a brief knowledge about swine flu today. We had pleasure to be with you. Thank you so
Thank
much.
you.